Americans have some of the highest rates of high blood pressure and diabetes, which are leading risk factors for stroke, and 80% of strokes can be prevented if identified and treated early. In honor of Hispanic Heritage Month, the American Stroke Association is launching R.A.P.I.D.O, a Spanish acronym to help raise awareness. Joining me this morning is Dr. Hugo R.A.P.I.D.O. Thank you so much. He's a vascular neurologist at Boston Medical Center. Doctor, thank you so much for taking time to chat with us this morning. We appreciate it.
Of course, my pleasure. Thank you.
The American Stroke Association has released new stroke awareness campaigns. As we mentioned, it's R.A.P.I.D.O. Tell us about this and what this means for people.
Yes, this is a culturally relevant Spanish acronym to raise awareness of common stroke symptoms. It was adopted by the association to address health disparities and to improve stroke outcomes in the Hispanic and Latino community. And it's R.A.P.I.D.O is an acronym. It stands for R for rostro caído or face drooping, A for alteración del equilibrio or loss of balance or coordination, P for pérdida de fuerza en el brazo o pierna or weakness in one limb, I impedimento visual, sudden vision change or vision loss, D dificultad para hablar, slurred or strange or altered speech, and finally, O for obtén ayuda, llama el 911, meaning to get help and call 911 right away.
What are some of the risks and signs that people should be looking out for when it comes to stroke?
Right. So the people who are most at risk for stroke are, one, people who've had a stroke in the past, but also people who have these vascular risk factors or uncontrolled risk factors that can include conditions like diabetes, hypertension, high cholesterol, obesity, and atrial fibrillation. So these risk factors tend to actually occur more commonly in the Hispanic and Latino community and at younger ages, such as overweight and obesity occurring among 80% of Latinos in the US, and then diabetes tending to occur at a younger age in this group. So these are some of the risk factors that can be present that can lead to higher risk of stroke.
Okay, all good information. Dr. R.A.P.I.D.O, thank you so much for joining us this morning. We appreciate your time.